Hey guys, so for those of you who may not know, I am a registered dental hygienist. I have been licensed for a little over 4 years, and I have been in dentistry for about 7. So to me, hygiene school feels like it was such a long time ago, but honestly, I do not forget at all that finding a new job as a new hygienist is really intimidating and it's not that easy. So today I'm going to be giving you some of my tips for finding a job as a new dental hygienist. So the first thing I want you to be aware of is that people are very weary of hiring new graduates, and try not to take it personal, but that's just how it is. People ideally want to hire someone who has had experience before, and this is something that I ran into a lot when I first graduated hygiene school. I moved to a bigger city to go to hygiene school, and I thought that it would be extremely easy for me to find a job because it seems that there are dentists everywhere here, but that is not the case. When I graduated, there were absolutely 0 dentists that were hiring. So what I did was I had to be proactive and go out there and find something for myself. So I printed out a resume, my cover letter, and some references because I had worked in the dental field previously. And I went to every single office within, I think it was like a 15 or 20 minute radius, and I introduced myself. I dropped off my resume. I told them that, I understand that you are not currently hiring, but I am a new graduate looking for work and I would really like to get experience. So if you need anyone to fill in at any time, if a hygienist needs, a day off, if someone's sick, please give me a call because I would love to help you out and get experience as well. So I did that for a ton of offices. I believe I went to 86 offices, and within a month I got hired. So I did a lot of filling in, but my biggest tip is definitely be willing to fill in and put yourself out there. So people aren't going to be coming to find you. You really have to go out there and find them. Another thing that you can do is cold call offices to remind them that you are available to help them out, just in case your resume has been misplaced or maybe they had forgotten, but just to remind them that you are interested. Dentists really like go-getters, so being independent and being, I wouldn't say aggressive, but just very assertive about things will get you a long way. A nice thing about temping is that it not only gets you experience, but it really helps you to understand and kind of figure out what kind of office you actually want to be working in. Dentists are very different from each other. Offices are very different from each other. So it's really nice to see how different practices work so that you're able to see what things that you don't like and what things you do like, so that way you're able to find an office that's a perfect fit for you. If you are unable to find something as far as filling in or covering someone's office for a day, you also can look into nonprofits. Nonprofits need a lot of people to volunteer work for them, so that is not a bad idea if you want to search for nonprofits around you just to get extra experience. Whenever you are going to your first hygiene interview, I understand that can be very intimidating because you are interviewing with a doctor, someone who is very knowledgeable, and you're going into an office where people already kind of have their own routine set in place. But remember that first impressions are so important, so whenever you go to your interview, make sure that you're early, but not too early. You don't want to seem like you're very unorganized and you don't have very good time management skills, because obviously time management is a huge part of what we do. Make sure that you give them a lot of eye contact and make sure that they know that you are very independent. Dentists are extremely busy. They are running 2, sometimes 3 schedules at one time, seeing their own patients, and then also they have to go in and do your hygiene exams as well. So they don't have time to be helping you on top of helping their own patients. So they need you to know what you're doing and be confident in what you're doing. So the more that you can show that you can do that for them, the more they're going to appreciate that. When you're in your interview, make sure you find out exactly what is expected of you. Like I said, every office runs very differently, so you need to know exactly what this specific doctor is going to expect you to do. Some offices that I've worked for want you to do nothing but just hygiene, only worry about your schedule. I've also worked in offices where they also want me to do scheduling. They don't want me to do recalls. They want me to pull charts. They want me to schedule patients and seat patients for the assistants. I've had so many different experiences in different offices, so you have to really figure out exactly what they want from you, because I promise you it's not going to be the same. You want to make sure that you're able to kind of continue on with the groove that they already have set in place at their office. Find out exactly what they want you to do in certain situations. So let's say you have your afternoon fall apart. Do they want you to go home? Let's say you have a patient who canceled. Do they want you to clock out for that patient who canceled or maybe no-showed? You need to know what you're supposed to be doing within that time. If they don't want you to clock out, then do they want you to be doing recalls? Do they want you to catch up on instruments? Do they want you to help with laundry or help up front pulling charts? What do they expect you to be doing within this time so that you're using your time as effectively and efficiently as possible? Of course, make sure that you ask about the important things. 401k, benefits, vacation, paid sick time, all of that. You need to know if that is something that you're going to get. Something that I've learned just in my own personal experience is that getting benefits in hygiene is extremely rare, at least in my area, and getting full-time is extremely rare in hygiene. So it's something that you have to be prepared for, especially if you have children or if you're over the age of 26 and you can't be on your parents' insurance. It's something that you need. So luckily I'm able to get on my husband's insurance, so that's not a big issue for me not being able to have it through work. But if that were not the case, I would definitely need to figure out an office that would be able to provide that for me. On top of the obvious things that you need to ask if they are going to pay for new instruments, if they're going to pay for your CE courses, if they're going to pay for your lunch and learns, if they're going to pay for new scrubs for you. You need to figure out exactly what things they're going to cover for you and make sure that it's in your contract or whatever you sign whenever you're hired, so that it is in writing. Just try to be as confident as you can, because you do know your job. Even though interviews are scary, I promise you will be fine, and the more that you do them, the better it's going to be. After your interview, it's always really nice to follow up with them with a phone call, just seeing if they had made any decisions yet. And also something that I personally do is I always send thank you cards after every single interview. So I hope that was helpful for you guys. Good luck. I promise you will find something, but please do not settle for anything less than what you want and what you deserve. If you have some tips of your own, please feel free to leave them down below. As always, thank you for watching. Don't forget to like, comment, and subscribe. Bye guys!